Hello everyone, welcome back to your own YouTube channel, Mind Body Tonic, and this is Dr Sita with you again. Last month, I had posted a video in Malayalam regarding unconsummated marriage, that is, a marriage in which the husband and wife has not had any proper physical relationship. I was shocked to realize that this is a very common problem faced by many couples not only in India but in abroad also. That video was in Malayalam, and after seeing that video, hordes of people started coming to me with the same problem. Some of them had problems with hymen, some of them had problems with vaginismus, some of them had problems regarding the male factors also, like premature ejaculation, erectile dysfunction, etc. Mostly the male partner problems might have been due to secondary to the female partner problem, because when the female shows so much fear and so much reluctance to indulge in physical relationship, naturally the partner gets put off and he starts losing interest, or he starts losing erection, or he suffers from premature ejaculation. Now, what do you do about this? Many couples keep silent about these issues. Some of them go to some gynecologist, they don't get proper treatment, they just hum and haw about their problem, and sometimes an ointment is prescribed which doesn't do any effect at all, and then they stop going to a doctor. Or sometimes a doctor may make some remark which was unintentional due to her busy schedule, but the patients might have felt very bad, the couple might have felt very bad after that, and after that they stop going to the doctor. Later on, only after a few months or a few years, when others, that is the families, friends and people in the society, start asking why you are not having children, why are you just roaming around, don't you want to have any children, go and see a doctor. Only then they reluctantly come to a doctor. They know that their problem is not about conceiving, but the basic problem is they have not been able to have a proper physical relationship. These were the points that I discussed about in my previous video titled Unconsummated Marriage. I'm not going into more details there, but this is the essence of what I talked there. Now, in this video, I specifically want to talk about vaginismus, because after seeing that video, around 40 to 50 couples, or maybe 30 to 40 couples came to me in the last 1 month with some issue or other which led to unconsummation of marriage. I was shocked to see the numbers, because that video was posted only 1 month ago, and around 2 lakhs people only saw that video, and out of that only a few people had access and could come to see me. So the real problem is much more, not only in India but abroad also, as we found out when I attended the biennial South Asian Sexual Conference in Bangalore in the month of November 2019. I discussed about that also in my Malayalam video. So, what exactly is vaginismus? Vaginismus is involuntary contraction of the muscles in and around the vagina, and also in the inner thigh. Here, in this condition, the lady need not necessarily have any aversion or dislike to the fact of having physical relationship with her husband. But the problem is, she is unable to control the way her vaginal muscles are contracting. So that leads to a lot of problem. Many couples have come to me saying that, doctor, we have done hymenectomy, we have done that procedure, we have done this procedure, but nothing works. We are still in the same boat. What I would like to mention here is hymenectomy is different from vaginismus. Vaginismus is an involuntary contraction of the vaginal region, as I mentioned before, whereas hymenectomy is a condition where the hymen is only, there is a small hole in the hymen, or the hymen is very thick and needs to be cut. Small surgery needs to be done in order for the male organ to go inside and perform the physical act, right? So, just because hymenectomy has been done, or just because you go to a counselor for some counseling who tells you that you should be like this, you should be like this, you should not have any fear, this is what all couple indulge in, blah, 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 and all these things are not going to improve. For vaginismus, there is a systematic treatment. So, before I forget what all points that are to be told, I have written down everything in a notebook. I'll just read out. One is, there are many factors why one person develops vaginismus. I'm not going to go into the detail of the factors here because the factors might be different for different couples or different women. So the first thing is to take a detailed history, and that is the part for which maximum time is being spent. Detailed history is taken to find out what could be the possible factor. Sometimes we cannot identify any factor at all. And then after that, the first thing that needs to be done as far as treatment is concerned is to teach the girl or the woman mindfulness, mindful breathing and mindfulness. The entire mindfulness concept cannot be taught in a single session or even in 4 or 5 sessions. It takes months to learn that, and even more months to practice it and perfect it and apply it to day-to-day situations. But mindful breathing and mindfulness as far as vaginismus is concerned needs to be taught, and that is something which we teach here. And another thing is pelvic floor exercises. Pelvic floor exercises is very, very important in order to relax the vaginal muscles. This is taught either from the labor room or from the OP, depending upon our convenience. And this may take sometimes 10 to 15 minutes, or for some people it may take half an hour. But this is not a painful procedure at all. I take care that no patient who comes to me go back saying that, oh, I had pain. No, I guarantee you that, right? I cannot guarantee about others, but I can guarantee about myself. Okay, so this pelvic floor exercises is the one which is going to help relax your vaginal muscles and make it possible later for the male organ to perform the physical act. And later you realize that through this vagina, which is a very expandable organ only, a 3 to 3.5 kg baby comes out. So just imagine how much elastic the vagina is. So there is no need to fear at all, right? Then another thing is, many times some amount of psychological elements are also there which contributes to vaginismus. So it is strongly recommended, and for my patients or patients who come to me, I strongly recommend that they come on a Wednesday when they come the first time, so that they can see the psychotherapist and counselor who comes here on that day and who will be here from morning 10 a.m. to evening 4 p.m. So they see her also. She's also a very nice lady. You can be very open with her. She's a very motherly person. So you tell her your issues and she will teach you some deep whole body relaxation. After that or before that, I will teach you pelvic floor relaxation. I will demonstrate how to do pelvic floor exercises. Even with all these things, it used to take sometimes 3 to 4 months or more for the vaginismus to be corrected. But fortunately and very luckily, we have now got a herbal labum or a herbal preparation, which is in an ointment form like Vicks, which when applied in the correct way, which I teach my patients, within 2 to 3 weeks, the entire problem gets solved. The vaginal muscles become very loose and that tightness disappears completely. And in the meantime, with counseling, with mindful breathing, with pelvic floor exercises, and with proper relaxation exercises that is taught by the psychotherapist, things will improve and definitely you will become all right. There is no doubt about it. I can guarantee you that. Right? Hymenectomy is not the only solution for that. So please keep that in mind. So please don't be disheartened that just because you've done a hymenectomy, spent thousands on that and then still not had result, you feel that you're doomed for life and you'll never be able to have a normal, proper physical relationship with your partner. In the meantime, your partner also might have developed some problem with erectile dysfunction or premature ejaculation or lack of interest or avoidance of having physical relationship because he feels that he is not able to satisfy you or he doesn't want to hurt you. So that psychological element also needs to be addressed by the psychotherapist and or counselor. Okay. So when you go to a doctor in whichever place you are staying, please take care of all these things. I don't think that I've left out anything. Yeah, I think I've mentioned all the important points. So when you go to a doctor in your place, please take care of all these things. In case you are not able to get satisfactory result, please do come down to me. in the past 1 month, and not only in the past 1 month, in the past 3-4 months, because if a few months ago I had put a video on tips to become pregnant series. The first video was husband and wife should have proper physical relationship to become pregnant. After seeing that video itself, many couples had come to me. At that time, initially, I did not have this herbal labor. Later on, I got it prepared by my herbal scientist. So nowadays things have become much easy. So if at all you're not happy, or if at all you're not getting good results in the place where you are staying, please do come down. We can definitely help you. But I would like to say one thing here. Please don't think that you can just come here, have a 5-minute session here, or maybe a 10-minute session here, and then go away happily along with the labor and everything will be all right. No, it's not like that. You have to come for minimum 2 sessions, both to me and to the psychotherapist. Sometimes you may have to come for 3 or 4 sessions depending upon other contributory causes or other causes which you may have. For some people it's quite easy, for some people it might be difficult. So please plan a visit only when you are in a state when you can come to me or come here to see both me and the psychotherapist at least once in 10 days or once in a fortnight for 2 to 3 times. It's not possible if you see me once and then say that tomorrow I'm going to Gulf and then after 2 to 3 months I'll come back for the next session. That's not possible. One patient did that last week. That's not possible. I told her that I will not be able to help you at all with one session. But she was a little comfortable after my session, first session, but that's not enough. And another thing is you have to come with your partner. If your partner is somewhere abroad and you are coming with either your mother or you're coming yourself, that is not possible. Both the partners should be present. So this is all I wish to say about vaginismus, which is a very, very common condition these days. God knows why it's so common. It's common not only in Kerala, not only in India, but throughout the world. That is the impression that we got when I attended the South Asian International Sexual Medicine Conference in Bangalore in the month of November 2019. So hope you all understand this, and if at all you are planning to come here, please call the hospital, book an appointment for a Wednesday when the psychotherapist and counselor will be here. Please call a couple of days before itself and tell her and tell the reception people that you wish to meet the psychotherapist also. Get her number from the reception. Please do not mail me. I do not have time to reply to each and every mail, and sometimes your important mails might be missed. So please call them and ask for the number of psychotherapists. Her name is Molly. She is also very friendly. She's a very motherly character. You will feel very comfortable with her. So get her number, call her directly and fix an appointment for Wednesday so that you can see both her and me in the same place, that is in our clinic. And then later on we will decide how frequently you need to come. Okay, so I hope all these is clear. Please do share this with your friends, contacts and relatives. Don't go about asking everybody, do you have vaginismus? Do you have vaginismus? Do you know anyone who has got vaginismus or such issues? Nobody is going to open up about these issues. Many people suffer silently. They try to just maintain their relationship. But many people suffer silently. I need not tell you that. You yourself know that. So please share this link with everyone you know so that at least some might benefit. Okay? So good night. I'll try to do more live sessions both in Malayalam and in English, because now the channel has reached another level. Now it's nearly 250 subscribers in this channel. So I wish that after 250 subscribers, 250k subscribers, the channel has to grow beyond just the Malayali crowd or Kerala. So that is why I've started English videos and English sessions too. Though I started a separate channel for English, I don't think it's working out and I am finding it difficult to manage both channels. So I'll be posting both Malayalam and English videos and live sessions in the same channel. It might be difficult for you to find out, but I'll be posting English in the thumbnail. I'll be writing English in the thumbnail for you to make it easier to identify and open it. Okay, so please do subscribe to the channel and please do share it with your friends and relatives. Take care of yourself and your loved ones and stay blessed. Bye-bye. Take care.